Hey everyone, and welcome to the Therapeutic podcast. As the name suggests, this podcast is everything about therapy and mental health, hosted by two counseling psychologists who have a lot to say and who would otherwise just sit beside a fireside and talk about it. So instead, here we are. Thanks for tuning in, and I hope you enjoy. Hello, everyone. Welcome back to the Therapeutic podcast. It's been a long time for us too. And this time, the topic is what really happens in therapy. Whenever I hear of this question, I'm reminded of the millions of people who have asked me this question whenever I tell them what I do for a living or that I'm a psychologist. And I have never been able to come up with a single line of answer for that. Like, what really happens in therapy? What do you do? What do you talk about? Or how does it really help? So, we are sort of hoping to answer all of those questions in this episode because therapy can really be very different for everyone individually because a lot of it depends on what the client, that means people, bring to us in the therapy session and what kind of therapy modules us as therapists we follow, and our experiences, the experience of the client, and a lot of environmental factors. So it is different, but there are also certain things that are definable, that can be discussed. So today we are trying to answer all of those queries and all of those questions, and hopefully we will be able to understand the gist and the gravity of the 1 hour session or the 50-minute session that a person has with their therapist, and what it means for them and what really happens inside it. Okay, Zainab, if you would like to start with this, I always think about this example when we sort of compare therapy with an appointment with a doctor, so of a different specialty. You've broken your bone, or if your car has been broken, that you're going to go to a mechanic or you're going to go to a doctor, and they're going to give you take a look at your symptoms, take a look at what has happened to your car, and give you medicines or repair your car accordingly. So you have an idea, a general idea of what you can expect when you go to a doctor or a mechanic for the first time. But I think with our profession, this is something can be very worrisome, or it can ignite some questions within people ki, Acha, what is going to happen, like what am I supposed to do when I go for therapy, what should I look for in a therapist? And I think we've covered a bit of these questions in our earlier episodes, but I think these are certain curiosities that also sort of make people hesitate to start or go to a therapist or start therapy, right? So what do you have to say about it?
See, I think the example that you gave of going to a mechanic or a doctor, I'll lead with that. When Even when we go to a doctor, we usually ask for recommendations from friends and family, right? We go on the basis of their reviews. You know, this doctor's fine, this mechanic's fine, and we go to that particular person. Now the thing
Right.
is, when you go to a doctor or a mechanic as well, you do have to give them a history. If you're going to a doctor with a broken bone, the doctor will still ask you about your history, which also means sometimes they ask you about your allergies, they ask you if you've ever broken your bone before, if you know something like this has happened before, or anything of that sort. So, but that history usually entails just the physical aspect of it, which people sometimes do share, sometimes they don't, because again, there's a little bit of a shame. Yes, I've broken a bone before. So what is the person going to, what is the doctor going to think? I'm such a careless person, right? But
Right.
going to a therapist, what happens is that you are not sharing physical symptoms. You're sharing real life experiences of yours, which you're connected with mentally and emotionally. And sometimes we don't expect the therapist to understand. We do go in thinking that the therapist is going to, is sitting there to understand what has happened to us. But also at the same time, from what I've seen, because I work with children mostly, or children, or even teenagers, they understand. These days they are very well read, right? So they know what therapy is, they know everything. But when they come to me in my setting, they just expect like a quick response. I have told you this, you know my history with so and so person. So now it is your job to go call that person and scold them for doing this to me, right? So I think that also happens otherwise, also, like maybe when you're seeing clients outside that are not from the children age group. Also, that when you're looking for a therapist, the thing is you do go on recommendation. Somebody tells you that, oh, this therapist is really nice. They helped me through so and so. And you take up that person's word. You said, okay, I'm going to go to this therapist, but that therapist might not work out for you. And I think we've
Yeah.
also discussed this before, that when a doctor doesn't work out for you, after a few, moments of thinking, you do end up going to another doctor. But with a therapist, a lot of people just stop, because again, you are putting in a lot of emotional and mental connection with that therapist. We've said this 100 times, that you need to build a rapport with the therapist. You need to have trust, which also means you will be saying a lot of things to the therapist out loud that you yourself have not probably accepted or, thought about consciously. So it does take time. So when you're also like going based on recommendations and it doesn't work out, people just take a step back and said, I tried, it didn't work out, and therapy is not for me. I'm just going to stick to doing something else that works out for me.
Hmm. I think that's a very valid point. And, we are doing a lot of heavy work when we are going for therapy, and it involves a lot of confrontation with ourselves. And yeah, as you said, admitting a lot of things that we've never said out loud, even to ourselves. So it is something that you're pouring out your heart really to a stranger, and doing it again and again to find the right fit is going to be exhausting. But I think
Yeah.
this is one of the things of the process, right? Like that just has to happen for it to be working in the future. That brings us to the first step of what happens in therapy. You also mentioned that what a therapist does is, build a rapport. And I think that's one of the first and the most important tool, most important technique, and the most unique connection that is there in the world. Beyond the familial connections, beyond the friend connections that we have with friends, or the connections that we have with our teachers, mentors, or anybody else, the rapport and the connection, the therapeutic relationship that you have with your therapist is very unique, and just something that remains inside that therapy room or that therapy session. And I think that's the first thing that happens. A therapist builds that safe place, builds that non-judgmental and a welcoming space for the client to feel that kind of safety and feel that kind of connection with the therapist that allows them to be so open with their own thoughts, that that they're able to say it out loud, that they're able to talk about things that is difficult to talk about difficult emotions.
Yeah. Okay, so before that, I think we'll also mention that three people might have the same therapist, but the way the therapist builds rapport with all three of them can be completely different, right?
Yeah.
So you can follow a certain approach as a therapist, but it's always tailor-made according to the client that you're seeing. So if I'm seeing client A, I might follow the same therapeutic technique with all the three of them, but with client A, I'll have to do it a little differently because I know they're going to respond that way. But also for us to understand how they're going to respond that way, again, it's a process. Meenal, why don't you give us one example or just two examples to differentiate how you've probably tried to build rapport?
It's a very interesting question. I think, again, this is something I don't think led it out loud a lot
Yeah.
of times. But yes, it's very true. With every client, there is a different angle you have to take towards building a rapport. So for me, it's basically figuring out what the client needs at this moment, like presently, what is their need right now. Some of them come with this need of, I'm feeling a lot of anxiety, there's physical discomfort that comes with anxiety, so we need to deal with that right now. And I know that there are a lot of things that need to open up before we get to the core of all of that. So before that, handling what is the issue in the present and dealing with it, bit by bit, I think that's what I would go with, firstly, with any client. So, and a lot of times it has happened that I have gotten clients that do not really need much other than just a supportive environment. So they would do all of that. They don't need to be guided or even questioned or nudged. What we do with other of our clients, they don't need all of that. They just need someone who is there and I think sometimes they even forget that a person is there. It's just that environment that has been created for them to be able to say all of those things and analyze all of that. And they do that. That such great work happens, and you get to witness it with them. I think that that in fact is very amazing.
Yeah.
And again, something that can only happen in a therapeutic session. They just need that. It's like a self-cleaning oven. I'm reminded of this phrase right now. So they do a lot of their work on their own. So yeah, I think the only thing that helps me is understanding what their need is right now in the present, and tailor need the things that I need to do to build that rapport with them according to what their need is.
Also, I think right now, because there's a hybrid sort of situation. Previously, I think before COVID, we just had people seeing clients offline. But right now,
Hmm.
even between the two of us, you see clients online and I see them offline. So even
Oh
the way that
yeah.
we build rapport changes, right? You have, I think, a limited amount of resources that you can probably use online. I
Hmm.
maybe have a little more because I'm seeing them in person. So especially because I work with a younger crowd, I can just pull out a few toys and just try to build a rapport with them, see what they're doing. So that
Hmm.
way, I think it changes again. Again, I'm not saying that you can just pull out like toys and different games just for a younger population, but it's easier because again, I'm seeing them in person and I can see their reactions and the way their body is reacting or how, their body's changing when they're trying to think of something or all of those things. I think it's easier for me to read their entire body language than maybe it is for online therapists where they're just seeing a box where not even half of your body is visible, just a little portion of the body is visible. But I think rapport
That's
building is the most important.
Yeah, and I think that's a very big advantage that offline therapists get, right? Like even not even with kids, even if you're working with adults, body language is something that is a great tool for us to understand what the client is,
Yeah.
the mood they are in, or the phase that they are going through. A lot of information we get from that, and not just you also mentioned games, right? Like play therapy, if I'm not wrong. And I remember that doing that when I was working with kids, and it used to work wonders. I remember the first day of my therapy with the first client that I had. I was so nervous to be dealing with that. The all the trainings that we had gone all out
Out
of
of the
my
window.
body, all out of my window. Yeah, all out the window. I was totally blank and I didn't know what to do. And I just went there and I played with this client, and it was so beautiful the way it all turned out. And I think play therapy is a great way of building rapport, and I think it works with adults. Sometimes I should say that a little bit of movement helps a lot. Even if it is your first session, sometimes all they need is a little bit of loosening up. Of course, there is a bit of hesitation because it's your first session. You have come with a lot of doubts and uncertainty of what's going to happen, and then someone tells you to just stand up and let's dance, or let's move our bodies a little bit. It gets a little bit weird, but it definitely works once you are out of that and you go with the flow. It has really worked, at least for me. So I think that's another way of building rapport. Yeah.
We're mentioning a lot of the word rapport building. So I think we should also clear what it actually means. So when we say we're building rapport, we don't mean we're just trying to get to know the client or just doing idhar udhar ki cheezein just to build and establish a relationship. Even during building rapport, we are trying to get to know the client. So there is work happening. It's not that
Hmm.
we're wasting sessions on just getting to know each other and then later the real work is going to start. This
Hmm.
process is also as important for the work that's going to come later on.
Definitely. We are also talking about, creating that safe space, which again is a very popular term these days, right? Like everybody talks about this is a safe space and you can, talk about a lot of things, anything that you want. You don't need to feel judged or anything. But yes, I think it is a lot of that. No judgment for you. And I think it's a very good way of also defining what differentiates uh, therapy from every other thing. That the therapy, other relationships that we have is sort of a two-way relationship. Like there is always a give and take, and I'm not negating the give and take completely here in therapy session, but there is one thing that in that therapy session you don't really need to think about or worry about hurting anyone else's feelings. You are
Yeah.
really free to be, getting it all out without really thinking about what is happening with the person in front of you, because that's how detached yet attached you are in that session and with that person.
This reminds me of something that I did with my therapist. We were discussing something, and I wouldn't say upset about it, but I was thinking, oh, if I did the right thing or not. And very naturally, like I would do to my friends, I asked my therapist, do you think I was a bad person? Or do you think I
Hmm.
shouldn't have done this? What do you have to say? And I remember her asking me, why does it matter? Or something along the lines of, why does my approval matter to you or something? And at that moment, as a client, I got so irritated because I said, just tell me, no, that I'm not a bad person. Like, why are you questioning that? Why does it matter? You are my therapist. Of course, it matters. But later, of course, when I calmed down, I understood that she was leading it to a different place altogether. But what you said about detach yet attach, I think this is a very common thing that happens, right? When as clients also, when we go to see a therapist, we put them on a pedestal, right? We say, acha, pedestal. We say, acha, okay, nahi, your input matters.
Yes.
And we don't, as therapists, we don't tell them this is what you have to do or this is what you're not supposed to do. That's not our job. We will tell you that you are the master of your own life and you're going to do what is right for you. You are smart enough to be taking decisions for your life. And if those decisions go wrong, we will help you to overcome them.
Cope with
That's
it.
what we,
Yeah.
yeah, cope with it. We're not going to tell you, Acha, don't do this. This is really stupid and you shouldn't be doing this. I mean, so I think I've experienced that as a therapist and as a client also. So I just thought I should mention this.
No, definitely. I think every therapist must have gone through this. That we do experience as therapists that we are put in a position that requires us to be validating a lot of things that our clients do, or brings us at a crossroads where we need to be proactive about the decisions that the client is taking in their lives. But that's not what happens. We trust that you are the driver of your own life, and we are here to support the wheels, grease the wheels, and if you come back with an accident, we are here to help you with it.
Yeah.
Yeah,
It's like
and
you're
I
running a marathon and people on the side are just cheering for you. I think we're those. Like, oh, yeah, you got this. Yeah, let's
yes,
do this. Like, we're those people.
yes, yes. I think we put on a lot of roles when we are in a therapy session. Again, depending on what is the client's need at that time, we put on a
Yeah.
lot of hats, depending on what hat the client is wearing at the moment. And this thing reminds me of curiosity that people also ask me about, that do you give a lot of advices, or what kind of advices do you give them or give to your clients? And I often hear this a lot from my family too. And it's very difficult for me to answer that every time I say that, okay, I am not the one who can give any advices. I am in no position to be giving you any suggestion because I haven't lived my life either. But yes, I do know to support you when something is happening in your life, or um, something that you need to process and something that you need to understand about yourself, and I can help you with that. I'm a facilitator, not
Yeah.
the driver. Yeah.
Yes.
We were talking about buzzwords, words that are thrown around a lot these days when we talk about therapy. One of them, two of them being, the boundaries. I keep hearing
Yeah.
them a lot. And trauma response. They're all over the Instagram these days.
Yes.
Everything is a trauma response these days now. But yeah, I think we could do a little bit of clarification. Yes, we talk a lot about boundaries in therapy, and it comes in different phases, right? Like a boundary can be something that you have to put for yourself, something that you do to, for your own self growth. Sometimes it comes to even protect yourself from people you love, and sometimes it comes to protect yourself from your own actions. So boundaries plays a very different role in very different scenarios. So I think that's another thing that we work upon a lot when we work with our clients. That is to understand where and how to put boundaries and how helpful for them.
I also think this is my very personal opinion that a lot of people maybe come across the concept of boundaries in a relationship while they're in therapy. I mean, sometimes
Mhm.
you can go into therapy and your therapist tells you, oh, this is what our relationship is going to be like. This is what we will be doing. This is what you probably expect me to know, but I will not be doing. This is not how it works. So a lot of therapists have different rules, right? That okay, if you call me in the middle of the night, there's a certain rule that the therapist follows. That what are we going to do about it? Or all of those things. I think people only learn about these things only when they're in therapy. Because
Yeah,
again, let's face it, at least in the Indian setup, we don't have a lot of boundaries. We say whatever we
definitely
want
not.
to, we
Mm.
do whatever we want to, and sometimes we even fail to recognize that the other person is getting hurt, which I think it comes back to one of our episodes of body shaming where we just name a
Mm.
person based on how they look. So when we see a person in our family who's a little on the heavier side, we start calling them golu, which is just we don't understand that, listen, that's hurtful and we shouldn't be saying that, but then we do end up saying it. So I think boundaries as a concept is probably learned in therapy for the first time. And at least for me, I find it a little I wouldn't say difficult, but also it's easy and it's difficult. It's in the middle ground when I work with children with these things. Because I remember, I think I was just in a class teaching these 4 or 5 year olds about their body boundaries and telling them, good touch, bad touch, safe and unsafe touch. You can't do this, you can't do that. And as kids, they have the habit of just going and hugging their teachers, they're kissing their teachers. And I was just telling them that we shouldn't do that. Ask your teacher for a hug, and if she's up for it, she will say, yes, you can hug me. So, again, because they're such young children, after I've got done with the little session, I walk out. I have these 2, 3 girls surrounding me telling me, ma'am, can I hug you? And they just hug me. So they didn't realize that they had to wait for me to say yes or no. They just thought, okay, I'm just going to ask the question. So I've done my job. So at that point, I
Mm.
felt like maybe I wasn't clear to them. So I had to go back again and do it. But I think this is just a small thing, right? But that's how
Yeah,
boundaries work in therapy as
yeah.
well.
We're so unfamiliar with this concept that we are allowed to put boundaries and that we are supposed to be
Yeah.
respecting other people's boundaries.
Yes.
And there is such a thing as, having a private space. And even within yourself, there are a lot of boundaries that we need to keep for our own self, not just from others, but for our own thoughts, for our own emotional peace. And so it's a very unfamiliar concept, and people take a lot of time coming around it. Even when it comes to putting it for the other person, it takes a lot of time for us to put it in practice, right? Because we know that the other person also is very unfamiliar with it, and it's going to take a lot of time for them to respect what we are asking of them.
Right.
Yeah, but I think it's a great lesson. Imagine if this what you're doing for the little kids, if when when they eventually grow up, boundaries is not going to come as a surprise for them, and it how different their adulthood is going to be.
Hopefully. I think right now for us, even having boundaries also comes with a lot of sense of guilt.
Definitely.
I think I was reading somewhere where somebody said that, therapists tell you that, oh, your parents are doing this to you, so you should set boundaries. And they said, do you not understand? I live in an Asian household. I can't just tell my parents that this is the boundary and they will just, you know, slap me
Okay,
across the face
okay.
and tell me, shut
Yeah.
up. Itni badi ho gayi and now you're telling us how you want to be treated. Like that happens. So even having we just say, oh, build a boundary with, and actually a lot of the like we see a lot of the pages on Instagram that talk about boundaries are psychologists or therapists from the West. So we've come to realize that in the Indian concept, probably boundaries might look a lot more different than they look in the West. Like I can't
Hmm.
tell my students ki, oh, tell your parents to leave you alone or do this or do that because that's not going to happen. I mean, obviously, I'm not going to tell my students to ask their parents to leave them alone, but the same boundaries that work for the clients in the West are probably not going to work for the clients in India, especially.
Yeah. Yeah. That's another important thing to understand, that how culturally different therapy can be too.
Yeah.
It's a lot of individual factors. Like, I think that's why I find it very difficult to make people understand what do I do for a living. Like, I don't know. I cannot have you witness it. I cannot explain it properly in words. But yes, I do. I hopefully do something meaningful that is helping others. Hopefully.
A lot of times what people say is, oh, you're just sitting and charging so much for listening. That
Mm,
I can also do. And it just gets a little tiresome because we're not just listening. That listening is, there's just so much happening. No, you're actively listening to the person. If you're somebody who takes down notes during session, you're doing that as well. But at the same time, you're making sure that your client does not feel that you are not paying attention. Or even after the listening is over, you go back and you're writing notes, or you're going through what happened in the session today. Maybe you as a therapist realize that this didn't go this way, or I should have responded a different way, right? So again,
mm,
even before the next session with the same person, we have to go through the previous notes. It's not like
yeah.
it happens every day. So you have to go through what we've done previously. We have to do a little bit of research. It's not like every day you just sit and you listen and you go, Acha, okay, okay. I'm sorry. Okay, I understand. I empathize, and we just close our laptops and go back. That's not how it happens, right? So
Exactly. And now
and a
give
lot
me
of
my
pages
fees.
on Instagram. Yeah, and then they say that, oh, this is my therapy and that is my therapy. Or who needs therapy when I have the beaches, or I have like Taylor Swift songs, and I'm just like, okay. They're not your therapists. They can give you comfort, but they're not your therapists. So
And I should warn people who are taking therapy from Zainab that this is probably the only time she gets judgmental, but not in therapy sessions.
yeah. Do
Yeah.
not, I mean, it is a lot of work, right? And also we do study so much. We There's
Yes.
a lot of doubt also that comes in when you're constantly questioning yourself as well. Because at the end of the day, if somebody's sitting in front of you and bearing their soul to you, let's say, and
Mm.
expecting you to help them a certain way, we can't just say whatever comes to our mind because they will take us seriously.
Imagine how many people say that, I'm very uncomfortable or I don't know what to say when someone comes to me crying or when someone comes to me with a thing that has happened to them and that has made them sad. You know what to say a lot of times. And it's true because emotional intelligence is something that is not taught to us, and it is not something that comes very easily. Even if it is taught, it takes work. And I think therapy again is a very wonderful place, very good place for you to work upon that. And this also, when people ask me ki, when should I be going for therapy, like when do I know that I have to go for therapy now, there is no such breakthrough point where that tells you, okay, now I'm supposed to go for therapy. And if that comes, that means it's already been late. You do not really need to have a any serious issue or any serious thing to be going through to go to therapy. You can simply go to talk about yourself. It's just a place that is very open, very safe, non-judgmental, very confidential place for you to just talk about yourself. How often do you get such an opportunity, or where even do you get opportunity? You will not get that with your partner. You will not get that with your parents. And I'm really glad if that happens with you, with your parents or your family or with your partner. But I suppose, I don't think I can say and define what the difference would be with this. And
Yeah.
nobody, and I don't think it's fair even to be unloading yourself like that on your partner or your parents.
So what you've told me when you say it's not fair to unload, also what happens is that if I am unloading myself from you, from telling you, Meena, this has happened to me, that has happened to me, and you are listening, but sometimes
Mm.
you really don't know how to respond, right? Now that again, if that person is somebody who really picks onto the little things of people, might again get upset that this person didn't react the way I expected them to react. So on top of the all the troubles that you're having, that's another trouble. Ki, they didn't respond the way I wanted them to respond. Or, oh, I thought that, and that has happened to me personally as well. When I tell a friend something and they just brush it off or they don't care about it, and I feel extremely upset. Ki, this is such a
Mm.
big deal for me. How come you are not acting like it's a big deal for me? But we, at that point, we don't recognize na, ki, maybe that at that point they have 100 different things going on in their head. But at least you know that in these 50 minutes that you are with your therapist, their focus is only on you.
Yeah,
And
exactly.
also, I mean, we are trained. Okay, it's not
Hmm.
like we don't have our own issues. We have our issues 100%. We have all the issues that you probably have. The only thing is that because we are educated in this subject, we probably know how to deal with it, and also that we try to get help before helping somebody else.
Yes, because therapists also go to therapy themselves. And that is why I think for us also, I would like to ask you this question, Zena, because we as therapists have also been to therapy. If when you are sitting as a client, what does that therapy space mean for you? Like, how do you take it? Like,
So
if you're okay sharing that.
for me, I think it's just for me, I'm not just a client. I think sometimes I'm also just looking at them and I'm going, Acha, okay, they responded to me this way. That's a nice way that they've responded to me. So, I can do
Oh my
that
God,
also.
yes.
Yeah.
I
So,
am taking notes as therapist while being a client. That's very true.
yeah.
Oh,
So I think that happens sometimes, and I should probably switch off my therapist brain when I'm in therapy. That doesn't really happen. But also, otherwise, I think it's just nice to know that there is also somebody else that you can go to as therapists. Because again, when we go to therapy, we don't discuss our clients. We don't do that, right? We only discuss our personal lives.
yeah.
Uh, because for us also it's important to separate work from personal lives, and our work can get heavy sometimes, and that might have an effect on our personal lives for sure. But at least for me, when I'm in therapy, I think I myself have a lot of things to deal with otherwise. But again, like you said, right, it's a process. Even for somebody like us, where we have a lot of contacts with of therapists, we still find it difficult to find somebody who's going to work for us,
Yes,
you know.
definitely.
So I do understand when people that are not in the profession say that, yeah, this is a really lengthy process, but
It is.
just keep trying, I guess, till you find somebody that works for you.
For me, the therapy space, or at least what I needed, was a place where I could really just talk. I needed a person who could listen. And because a lot of times I realized that I do things, but I am not in awareness of, doing those things, because sometimes I feel like I do not witness my own things that I'm doing outside. And when I'm talking to someone, I realize that, okay, oh, I'm acknowledging it out loud. And that in itself feels very good to me. And that is very revealing of my own personality, of my own things that I like or I do not like, what works for me, what does not work for me. For me, that therapy space is it's a very inviting place that's just
Yeah.
for me. So it's very personal and it's very intimate. And yeah, I think that's why I value that place a lot. It means a lot for me. And I hope
Yeah.
that us as therapists, we have done the same for our clients too. You were also talking about active listening, right? Like, and I was thinking that even while we're listening clients talk about a situation, like something happens and they want to discuss the same thing, in therapy, a lot of times clients tell me that, oh yeah, this was happening to me. And immediately this thought came that, oh, I have to discuss this with my therapist, and it feels really good. Like, okay. So this has been happening, and they're really realizing that what can be worked upon in therapy,
Yeah.
within that therapy space. So when they're talking about a situation, they unload a lot of things, and there are one feeling comes out, and there is that is followed by another feeling, and then another feeling, and sometimes they digress. So when that active listening is happening, a lot of things are happening inside us of, we need to think of what we need to talk about first, or what we need to pick from all of the information that has been given to us, and what will be best for the client to talk about today. And we sometimes ask that to our clients, sometimes we choose that ourselves depending on what the situation is. And so within that active listening, a lot of process is happening, that will lead the session, and that will lead to uh, what will be discussed with the client. And I think it's such a surgery of thoughts that is happening. And we talk about feelings a lot, we talk about emotions a lot, and from those emotions itself, there are a lot of things that are revealed to the clients, informations about themselves. Even in that situation, why did I react the way I reacted? A lot of questions are answered that way. And I think a lot of our role in that is to ask the right questions, and nudge them in the directions to think about things that they may not be they may not come across, or they may not be ready to think about. And it's our job to bring all of those things to light. I also sort of had an example of a very small act or a very small process of what we do sometimes when we ask the questions of where is this happening in your body.
Ah,
Yeah. So I'd like to mention that I'm a trauma informed therapist. So a lot of my work takes, I do sometimes talk about a lot of what is happening in your body, the physical symptoms that comes with anxiety, that comes with depression, or any of the things that we talk about, right? Every emotion has the seat, physical seat in your body. So when we talk about that, we do say that, yeah, anxiety manifests itself physically, and we ask that, how does it show in your body? It can sometimes come out as pains in your hands, or sometimes cold shoulders, or very heaviness that you feel in your chest, butterfly feelings in your stomach. Sometimes people feel cold hand and feet, a lot of things, even sweat. It can come out physically. I feel that sometimes clients are more aware about these things, and sometimes they're not, and sometimes they're also shocked about ki acha, this is why the physical thing has been happening. And then we take that physical symptom and we talk about, where is this been coming from, or what does that heaviness mean. So I think
yeah.
that's one of the processes that happens in therapy.
Very recently, I had this episode. I was out. I was supposed to go meet a few friends, and for some reason, the minute I got the invite, he let's go. I I had this sinking feeling in my stomach. You mentioned butterflies. I think for me it was a sinking feeling, and I
Yeah.
was like, oh, theek hai, koi baat nahi, whatever. And then I went along with my day, and then when it was actually time to meet them, I was going to the place, and I actually went half an hour late, and I called up a friend on the way and asked him, "Acha, where are you?" And he said, "I'm going to take some time." And at that point, I lost it. I said, "No, no, no, you have to come right now." And he said, "Okay, give me some time. I'll be there." And once I reached there, the people who were the hosts, they were not there yet. And I remember sitting over there, hands were sweating. I felt like my clothes were tight and I could not breathe. And there was this heaviness on my chest. And I remember messaging one of my really close friends who's also a therapist. And the first question that she asked me is, "What's happening? What are you feeling in your body?" Just like you mentioned, right? So I told her everything. I said, "No, I can't breathe. I feel like everything's tight. It's going to rip open." And, just all of those feelings. Now, the thing is that at least with me, I knew that I was having an anxiety attack at that point. I knew it. I knew what I had to do also to calm myself down. But I also understand how difficult it is sometimes. I was in a public place and I was sitting alone in this huge table where there were other 10 people who were about to join me. There were four servers standing right there, probably seeing that this girl here is losing it. And
Mm.
obviously they didn't know because I have my phone constantly, like, just messaging and just telling my friend, listen, I can't do this. I don't know what's happening. Trying to coordinate with my other friend, please come quickly. And I didn't realize I've hung out with those people before. I know them very well. So also, I think, again, I haven't sat down with my feelings. I haven't thought about what triggered it, but things like this can happen.
Mm.
So, like you said, that even at that point, I would have appreciated if I had a therapist at that point telling me, okay, listen, do this or do that. But I didn't. But it helps having friends who are therapists who can, get on the call with you and just be like, oh, it's okay, let's do this, let's do that. But yes, it's a very real thing.
Yeah, it definitely is. And sometimes I feel that when I am speaking to a friend who is having, similar things, or they're sharing something with me, and it's a very difficult line to draw between being a friend and a therapist.
Yeah,
Yeah.
for
It's
sure.
just that, yeah, you just go into that flow and you're back in that therapy mode again. It's difficult to get out of it. And I think it was thank you first of all for sharing that experience, because it's definitely scary, and I think it was very helpful for you to know that what you are going through is an anxiety attack, and just knowing that would have given you a little bit of relief that, okay, yeah, at least I know what is going through. I might not know what to do immediately, and I am going through it. But just having the name to it gives a lot of relief to understand what is on with me. But imagine if a person is just sitting there and all of these things are happening and you don't know where is it happening from, or why is it even happening to you, what to do when it is happening, and that situation can get really, really scary.
It does. Yeah, it can get scary.
Right. So I think we have discussed a lot about what happens in therapy, and I hope this answers a lot of questions when people ask, what do you do beyond talking?
Yeah,
So yes, we do talk, we listen, we do listen a lot, but there are a lot of elements involved in that talking and in that listening and in us spending that time that is sacredly designed for you to, working upon just you as a person. And I think even the end of therapy, like not just the end of the session, the end of termination of a therapy with a client can also mean a lot of things. So I do get questions that, when do I stop therapy, or when do we know that, this is going to be the end of it? And
right.
that can also mean very different for everybody. Definitely, it does not mean that, you've reached the cured version of you. There is no such thing as that, and people have different goals. That is, I think, one of the other things that we do when we begin therapy is to set goals with our clients of what has brought them here, and
Yeah.
what do they expect from this space, and what are their expectations, and what goals do they have in mind. And if they don't have any goals in mind, we sort of help them, we build them together. So one of those things is also important, that we understand that the goals that we wanted to achieve have been achieved. Again, that definitely does not mean that you're cured, but a lot of it also means that things will happen the way that have happened with you, but you might have a better hold on yourself on how to be dealing with those similar situations in a better way.
Like you mentioned that we set goals. Now, I think this is a very probably a common question that people do have, and I'm going to throw it at you. Let's say the set of goals have been achieved, everything's done. Now, do you as a therapist terminate it, or do you wait for your client? I mean, I'm sure people think, Acha, okay, maybe the therapist says, oh, you're done now. I don't think there's more to it. Or maybe, the client is waiting for you to say, Acha, okay, we've done great things, but I think it's time for you to go now. Or as a therapist, you wait for your client to say, okay, no, I'm done. Thank you very much.
I think again, this is something that should definitely be discussed with your client. Like, if feel like we have come to a point where, that we have achieved the set of goals that we set out to achieve, and it can be a point of discussion that, okay, so, this is how we started our therapy, and we are here in this place. How do you feel about it? And what do you feel like we should do? Do you still want to continue? Are there things that you want to talk about? Or if there is a question of termination, I definitely do ensure that we have a separate session for that, so that we ensure that we do not really want our clients to be dependable on us, right? So we want to
Yeah.
make sure that what the work that you do in therapy is very much applicable there in the outside world. So ensuring that is also, I think, very much important before you go for termination. So having a proper discussion with your client about how they are feeling with all of that. And there sometimes there can be a lot of restriction from the client side when we talk about termination, right? Different feelings can come out. So it's very important to talk about those things too. And then if the time allows it, if the client's feelings allow it, yes, we do terminate it at a point. And it's not the end of therapy for the client itself, because life happens, right? And at any point, you may feel like you need to go to a therapist back, and it's absolutely okay.
Right. So it's not just a one-time thing. It's not that, oh, I've done this for a year now.
Yeah, so
I'm
I'm
good.
done and dusted for the whole life. No.
No, you're not. I mean, in that situation, maybe you thought you needed help and you got that help and you know how to deal with it now. But again, like you said, this is life, and life will throw another curveball at you that you absolutely don't know how to deal with. You're going to try
Yeah.
your best, of course, use everything that you've learned in therapy. But sometimes you might just feel like, oh, I can't do this alone. I might
Hmm.
need somebody to guide me through it or just help me through it. And that's when you can decide, oh, I want to go back. And going back never means that you have failed in any way. It is not
Yes.
a failure.
Hmm.
You are human, everybody's human, and we do need a little nudge from time to time. So there's no shame in terminating, and there's also no shame in restarting therapy again.
Yes. And therapy is also not just about actions of, doing things. It is
Yeah.
also a space for you to just allow yourself to be yourself. Sometimes, there are people. I read this somewhere that, when you are traveling to a different place alone, especially when you are within people who have no idea of you as a person, you will get to, discover a lot about yourself personally.
Yes.
And I think that happens in therapy too, that you just go there and you are with a stranger who is there to understand your feelings, who is there to understand your situation and be objective, not judgmental, but be objective about it. There are a lot of things that we ourselves do not see because we are in that situation. We are not seeing it from a third person's view, from a bird's eye view, to be more clear. So that's what a therapist does too. So it's not just about learning to take actions, but it also just to unload or talk about yourself and the space for you to just be you. And also, it would be helpful for us to remember that therapy is not like a eureka. You'll never get a eureka. I mean, of course, you'll get a eureka moment when you're in therapy session, but it's not like a big thing that happens in your life which is going to be noticeable, as noticeable as a firecracker. Like it just
Yeah.
bombs and you can see the lights coming out of it. It's not like that. It's a series of small breakthroughs that you go through, and very subtly you see the changes in your life that is happening with all the work that you do inside therapy. I think that's one expectations we also try to manage with our clients.
Okay, Meena,
Yeah.
now that we've neared the end of the podcast, I'd like to ask you a question. Is there
Hmm.
one therapist that you've seen on screen who, after you've seen them, you felt like, kya bakwas hai ye?
On screen as in on like social media or
Yeah, no, not social media, like a representation of a therapist in a movie or a TV show, and you've seen them work and you've just thought about it and you've been like, this is not what we were taught. I don't know what you're talking about.
I think and I think there are a lot of better examples, but this one comes to mind. The How I Met Your Mother. It's a very obvious one. Like in one of the seasons, there is this therapist that Robin starts to date.
Okay.
I saw that one episode where like a very small scene of therapy is shown of how she has been to therapy and the therapist is just sitting there and they do a little bit of talking and everything. And I think when I started seeing clients and I'm like, okay, what was I just seeing? Why did I was a little bit offended when I saw that. Does anything
Yeah.
else comes to your mind when you
I
think
was
about this?
recently rewatching Friends, and I got to
Ah.
that episode where Phoebe is dating one of these
Oh
psychologists,
yeah. Yes.
psychiatrists. I don't know
Yes.
what he was. And
Yes.
just the entire episode where they show us that he's just constantly analyzing everybody in the group. And he's just
Yeah.
doesn't respond. He's like, oh, so maybe it's because of this. And at the end, we see that everybody gets so irritated with him. And they're like, can you just stop hanging out with him? Can you stop dating him? And then later, Phoebe also realizes that, oh, he was insufferable. I cannot be with him anymore. I think as psychologists, when we are in that situation, we're not constantly thinking about what is wrong with this person. There are moments, of course, we can't stop being a psychologist, but we don't let that aspect of our lives lead us completely. We're not going to be sitting in front of somebody and be like, I'm sensing some issues here. We don't say that stuff to people randomly.
Especially not in a social setting when you're there to meet your girlfriend's friends.
Exactly.
And I think if I were the therapist of that therapist, I would be asking like, what makes you do that? Like, why can't you just be friends with them?
Yeah. I mean, he was using his skills to make friends, and initially we see in the episodes that they love him. But then later,
Yeah.
when he starts hitting a nerve, that's when they
Mm,
start realizing, "Acha, I don't like this person at all. Just throw him out of your
mm.
life." So yeah, I mean, you know how not to behave if you're a therapist in a social setting for sure.
Exactly. As always, we are back to our examples of friends, and I think this is a pretty sweet space to end our podcast. Hopefully, if not all, at least few of your questions and curiosities must have been answered of what really happens in that 50 minutes of therapy session that you go to. What does the therapist do? What you as a client do? And what does that space mean for you? And if you are someone who is going to therapy right now, I think that could also be a good question for you to think about. What does the therapy space mean for you? So thank you all for listening, and we will see you in our next episode.